We've all been there, right? You go to the doctor, you give a blood or urine sample, and then you just wait for that call with the results. We put so much trust in those numbers, but have you ever stopped to wonder, how do we actually know they're correct? Well, let's dive in.
And this is a much bigger deal than you might think. It turns out that a whopping 70% of all clinical decisions, we're talking everything from your diagnosis to your treatment plan, hinge on the results from these lab tests. That is a massive amount of responsibility resting on one tiny sample.
So, that brings us right to the core question. With so much riding on these results, what kind of systems are working behind the scenes to make sure that the numbers coming out of that lab are accurate and reliable every single time?
To get that answer, you first have to realize that from the second a sample leaves your body, it goes on a pretty complicated and kind of risky journey. It's not as simple as just popping a tube into a machine and getting a printout. Nope. There are a bunch of different stages, and every single one has its own pitfalls.
This whole journey is really broken down into 3 key phases. First up is the pre-analytical phase, which is, everything that happens before the actual test. Then you've got the analytical phase, that's the test itself. And finally, the post-analytical phase, which is everything that happens after the test, like getting the results recorded and sent to your doctor.
So, let's start at the beginning with that first phase. This is the whole trip from the doctor ordering the test all the way to your sample showing up at the lab. And believe it or not, this is where things can get really, really tricky. Now here's the first thing that might surprise you. You'd probably assume that most mistakes would happen inside those super expensive high-tech testing machines, right? Well, the data shows the complete opposite. The vast majority of lab errors actually happen outside the machine, in all the steps leading up to and following the analysis.
And when you think about it, it makes a ton of sense. I mean, there are so many human touch points. Is the request form filled out right? Did the patient do what they were supposed to, like fasting for a glucose test? Is the sample tube labeled with the right person's name? Was it collected in the correct container? Was it transported properly? A tiny slip-up on any of these can totally throw off the final result.
And this right here is the critical part. If a mistake happens at this stage, let's say a sample gets mislabeled or it sits in a hot delivery van for hours, it doesn't matter how perfectly the lab runs the test, the result is already junk. And that one little error can cause a domino effect, leading to a delayed diagnosis, or worse, the wrong treatment.
Okay, so let's assume the sample made it to the lab in one piece. Now we're entering the analytical phase. This is the black box where the magic happens. Except, it's not magic at all. It's an incredibly controlled process watched over by some seriously strict statistical guardians.
So to understand these guardians, you gotta know 2 really important words: accuracy and precision. Think of it like archery. Accuracy is all about hitting the bullseye, how close your test result is to the true, correct value. Precision, on the other hand, is about getting a tight grouping. It's how close your repeated results are to each other, even if they're not dead center. And in the lab, you absolutely need both. The whole system that keeps an eye on both accuracy and precision is called quality control, or just QC. You can think of it as a constant series of checks and balances humming along in the background, making sure the lab's equipment and processes are running exactly the way they're supposed to, all day, every day.
But QC isn't just some abstract idea. It's a very active system. It's got alarms built in, designed to catch problems the second they start. So, how does the lab actually see the data and spot an error before it can ever affect a patient's result?
Well, they use this tool called a Levey-Jennings chart. Every single day, the lab runs a special control sample, one where they already know the correct value, and they plot the result on this chart. When everything's running smoothly, the dots just kind of bounce around that center line, all nice and random, staying within the acceptable limits. This chart here, this is what you want to see. It's beautiful. It shows a healthy, stable process that is perfectly in control.
Okay, but that's what it looks like on a good day. What happens when a machine starts to drift a little, or a new bottle of a chemical is just slightly off? How does the system actually sound the alarm?
This is where a set of, digital detectives comes into play. They're basically a series of statistical rules called Westgard rules, and they're programmed right into the lab's computers. They are constantly scanning that QC data, looking for specific patterns that might whisper, or sometimes even shout, that something's gone wrong.
And right here, we can see these detectives on the job. Look at the chart on the left. See that one single data point that suddenly jumped way outside the lines? That's a 13S violation. It flags a potential random error. Could be something as simple as an air bubble in the line. Now look at the chart on the right. This is different. We see 10 points in a row all on one side of the average.
That's a 10x violation, and it points to a systematic error, like the system is slowly drifting out of calibration. These rules are smart enough to catch both kinds of problems.
The second a Westgard rule is broken, an alarm goes off and bam, everything stops. All patient testing on that instrument is put on hold immediately. No results go out the door. An investigation kicks off to find the root of the problem. Is it a bad chemical? Does the machine need to be recalibrated? And only after they've fixed it and the QC data proves the system is stable again, only then can they resume testing patient samples.
This internal system is obviously super robust, but here's the thing. It's not the only line of defense. There are actually two completely separate layers of quality control working together to make sure your results are trustworthy.
So everything we've been talking about so far, that's internal quality control, or IQC. The lab does that every day, on site, to check its own precision, to make sure it's getting that tight grouping. But then there's also external quality assurance, or EQAS. This is when an outside agency sends blind samples to the lab every month or so. The lab has no idea what the real value is. They run the test, send their results back, and get graded against hundreds of other labs. This checks their long-term accuracy, making sure they're not just precise, but they're hitting the actual bullseye.
And all of this, every chart, every rule, every single check, it all comes back to one simple but incredibly powerful goal. Just as our source material says, reliable lab testing is what prevents misdiagnosis, it prevents delays in treatment, and it prevents the cost and hassle of having to do tests all over again. It's truly one of the invisible pillars of modern medicine.
So the next time you give a sample, you can rest easy knowing there's a whole army of guardians and digital detectives on the case, making sure everything is just right. And it really makes you wonder, doesn't it? What other invisible systems like this are out there, working tirelessly behind the curtain to keep us safe every single day?